My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
Well, we're going to talk about open and closed rhinoplasty today. So we've got a bunch of great questions from our patients about this. So you see a lot of patients who are hoping for rhinoplasty surgery, and a common question they have is open or closed, and oftentimes they prefer a closed approach. Can you explain why that is and what are the pros and cons?
I don't know why they prefer the closed, other than maybe reading, information about it online, and they somehow, I think some people feel as though the closed approach in some ways is less invasive, and it's actually probably not true. The main difference between an open and a closed rhinoplasty is the necessity for a small incision in the columella. So there's a little tiny incision that can be made right here that allows for this skin and the skin on top of the nose to be elevated so that the visualization of the nasal tip cartilages is unprecedented. You just cannot see and manipulate those cartilages nearly as well without actually lifting the skin off so that you can see them. Now, what concerns people is they wonder if this is going to cause a visible scar, and it doesn't. That area of skin is very supple. It heals extremely well. It's facing the ground, and I often see patients who may have had surgery several years ago who come to me for revisions, and they have a small scar there, and I can sometimes not even find it. So I think that the having a scar in the columella really, in practical terms, is a non-issue. It's just not something that people notice or see. What it does allow, though, is an incredible amount of visualization of the nasal framework. It allows for a much more stable repair of the nasal tip, and a huge number of potential things or maneuvers that can be done securely with the nose and predictably via that approach. And I think that in the vast majority of cases, I think it's superior to a closed approach. Now, some surgeons prefer to use the closed approach. Maybe that's the way they've trained, or that's the way they've marketed their practice, and so they sort of try and stick to that. And I don't think there's anything wrong with that. I think it's much more predictable and much more stable to make the types of repairs that we often need to make for the nose through an open approach. So the other issue, I mentioned it before, was whether one was more invasive than the other. In a lot of ways, I find that the closed approach is more invasive than the external approach. And my rationale for making that statement is that with the closed approach, incisions are made on the inside of the nose, and the nasal tip cartilages actually have to be separated from the nasal septum and from their other attachments and moved over to access the bridge of the nose. Whereas with an external approach, those cartilages and their attachments can remain intact, and you basically just lift the skin up and sneak over them to get access to the nasal bridge. So you're not really disrupting the support mechanisms of the nasal tip, and I think it's actually less invasive to do it through an external approach than internal. But as I said, I think this is sometimes it's surgeon preference. A lot of it really is marketing, and I think if some practices are marketing a closed approach as a way to differentiate themselves, then I think they tend to want to use that approach when they can. I don't think it's as good. I don't think it's as versatile, and in my practice, I rarely see it being the approach of choice.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.